Good afternoon all and welcome. It's so wonderful to have you here with us today. My name is Emma Quigley and it's been my absolute honour to have been part of the Leukaemia Foundation since 2006. I've had the pleasure of holding several roles over that time, liaising with many wonderful friends who have supported such events as the World's Greatest Shave, Door Knock, Light the Night, plus those who have kindly supported the Foundation through making donations. But most recently, for the last 5 years as Gifts in Wills Officer, it's been my privilege to connect with our friends and family who choose to support in this meaningful way. It's so great to see many of you, our friends, members and supporters, online with us today. I love seeing so many familiar names registered as well. Thank you again for joining us. Before we begin, some housekeeping. Today's seminar is being recorded. Your microphones are muted and your cameras are off. I encourage you to ask questions via the Q&A function located via the Q&A panel on the side of your screen if you've joined today via computer. Or if you're joining on a smartphone, please click the 3 dots to access this function. Feel free to add questions when you feel, and we'll endeavour to add these and address these at the end. Today, we are so pleased to share with you a brief history of the Leukaemia Foundation and some stories of people who have seen and been the change in the Foundation. Firstly, Dr. Trevor Olson, haematologist and Leukaemia Foundation co-founder, will set the scene of where we began. Then Mary-Ann Skaparis, a staff member of the Foundation, who has provided patient support since 1992, will join us. We are also very blessed to have Sandra Evans share her story. Sandra and her family faced the devastating news of a blood cancer diagnosis in 2006 when her then 4-year-old daughter, Talia, was diagnosed with acute lymphoblastic leukemia. Mary-Ann and the Foundation team supported Sandra, Talia, and the family while staying at our ESA village. In 2017, Sandra further published a book on her family's blood cancer experience, 8 Seasons, Our Family's Journey with Childhood Leukemia. We're then going to hear from Blood Cancer Support Coordinator, Catherine Treble, who will reflect on how her role looking after patients and families has evolved with the Foundation's national focus. I'd now like to share with you a special video message from Dr. Trevor Olson. As someone who was there at the start, we felt it was important that you heard directly from him as to our beginnings.
It's always been a little stressful treating sick people who are going to die. In those days, if you didn't respond or if you weren't treated, you had an average survival of about 6 weeks. I came back to Queensland at the early 70s, and it really was backwoods type medicine. Not necessarily in the talent of the medical people, but in the facilities that were provided. I remember early in the piece that I was looking after a young man, a delightful young fellow whose wife had recently only had a baby and they'd had another one. And he died, and I got so upset about that. And I started to think, yeah, if I'm going to do this for the rest of my life, I had to rethink where I was and what I was going to do. And I wrote to a lot of support people. The only one that really listened to me and put his hand up was the Lions Club. It never seemed hard work. You know, the first meetings were held at Keith Ledger's place in his billiard room around a table, and then we'd finish the meeting and have a few drinks and maybe a hit at billiards and go home. And then there were a few things that we had to get done, like the accommodation block and the self-separator. if people are going to come to Brisbane because the treatment is better than it is in Townsville or in Longreach, then they're away from home, so we've got to have somewhere for them to live. So we bought a old Queenslander in Annerley and did it up to 3 flats, and they'd never been empty, ever. When people would come to Brisbane from out of town, we would see them for a time and then they'd go back. We would take them shopping and so forth and support them in their accommodation, but then they would go back and we might not have much to do with them. So then we wanted to expand the foundation throughout the state, so we then started a branch structure. And I think that was extraordinarily important. It then meant that there was a sort of an outreach foundation branch in the town, and they would look after them when they even got home. And during the 80s, we were much more of an ad hoc sort of foundation, and I was trying to work on things being done. And the main reason that I wanted to take on the presidency was to take the next step of fundraising and reinvigorating the foundation and getting bone marrow transplant in Queensland. And that needed a lot of money. If you're going to get a lot of money from corporates, then you need someone who understands corporate. So we got high-profile people, the Knights of the Realm and members of Parliament, and a very good committee was established, and we then went for it. Having done all the things that we essentially wanted to do, set everything in place, like the research, we got ourselves a professorial position with the university and continued research, which was great in the long term. What the equipment, and every hospital that needs it can apply to us and upgrade to what the standard is. All of these things were done, and then I felt we need an Australian body. We've done Queensland, we better do every other state to be as good. And then we set it in place, and I didn't realise that it was going to take so long and be so difficult. It's easy when you get to my age to look back and think of the things you should have done or could have done. But you know, when people have said, did I ever think that it would grow to the size that it is? Did I ever think the foundation did I plan anything like that? And no, it was always just seeing the patients that we cared for get better and have their families look after them and get joy from them. And that should be enough, I think, to motivate a lot of people. But there is no doubt that the Lions Club was totally integral in the commencement, the success. They have helped me enormously in everything that we wanted to do with the foundation.
Wow, what an incredible story from Dr. Olsen. This truly is an example of from little things, big things grow, and the power and vision of passionate people and communities. Dr. Olsen also wanted me to convey his personal thanks to each and every one of you, as well as acknowledge some difficulties over the years in the transition to a national body, but he's very pleased to see good progress is occurring. I'd now like to continue sharing our pictorial history. As Dr. Olsen shared, in Queensland in the 60s and 70s, medical staff did their very best to deliver quality care for blood cancer patients with few resources. Here is a leukaemia patient in the late 70s being cared for by a nurse in Ward 1D of the Royal Brisbane Hospital. A bone marrow transplant was a new life-saving procedure, but a lack of transplant facilities in Brisbane meant those strong enough to undergo a bone marrow transplant had to travel south. Their families made the arrangements and covered the expenses. Sadly, many people with leukaemia passed away while their families suffered and the medical staff looked on in despair. At the time, Dr. Olsen was treating a young boy whose father, Bernie Stevenson, was secretary of the Holland Park Lions Club. Here is Dr. Olsen and Bernie, and they're pictured with fellow Lions Leukaemia Foundation founder, Keith Ledger. After watching his young son pass away from leukaemia, Bernie introduced Dr. Olsen to the Holland Park Lions Club, and the Lions Leukaemia Foundation was formed on the 9th of October 1975. The foundation set 4 goals: to provide medical care, provide patient support, fund research, and educate patients, their families, and nursing staff. For Dr. Olsen, the foundation represented a dream come true. Not only had he secured strong support from the Lions, but in the process, he had gathered a group of people who were willing to work very hard to combat this deadly disease and provide patients with life-saving equipment. Fundraising took off with a bang. Walkathons, fairs and fetes, sausage sizzles, even bathtub derbies. The grassroots fundraising that laid our foundations and still exists so strongly today. Pictured here at a fundraising barbecue at a country music festival in 1978 is Ralph and Narelle Murphin and Fred Bylett. In 1980, the Lions Leukaemia Foundation became the Leukaemia Foundation of Queensland. The foundation entered the 80s with great ambition and drive following the success of the previous 5 years. This would be a decade in which the foundation would prove its power and position as a not-for-profit organisation and illustrate to the community how effective it could be in bringing about major medical and government change. It was a decade of numerous projects underpinned by the support and dedication of many volunteers in the community. And I just want to take a moment here to acknowledge all those who have supported, the people behind and beside those key founding individuals, all the staff and all the members over the years. The decision to change the organisation's name allowed for the formation of branches. As Dr. Olsen touched on, this contributed greatly to raising funds, as most branches formed in country areas and fundraising efforts had proved very successful. Branches also afforded the foundation an opportunity to increase public support. Branch members were able to report on foundation activity in the big smoke and encourage their local communities to continue support of blood cancer patients. Many factors influenced the formation of branches. However, compassion, care, and commitment were and remain to this day common to all. Some branches developed after a blood cancer diagnosis of a loved one. Others formed to expand the support base and fundraising opportunities. Young Tony Spies, pictured here, was the catalyst for his grandfather, Len Spies' dedication to forming Leukaemia Foundation branches across Queensland. The pictured tree is still immortalised today, honouring Len at our ESA village in Dutton Park. Branches were busy fundraising. Members of the public and community organisations around the state were also devoting time and energy to raising money. The events were many and varied. A novel fundraising event that the Mount Isa branch held was Dung Sundays, with volunteers bagging and selling manure at $2 a bag. By the early 90s, there were 28 branches across Queensland, raising awareness, funds, and providing patient support in their communities. Our branches and members have made and continue to make a massive contribution to the Leukaemia Foundation through their advocacy and support of fundraising projects, including the funding of medical equipment, bone marrow transplant units, research grants, and accommodation for patients and families. In the years since the 80s, with your help, the Foundation has supported and cared for many thousands of people impacted by blood cancer. Today, blood cancer continues to impact over 100,000 Australian families. In fact, blood cancer is one of the highest causes of cancer death in Australia, claiming more lives each year than breast cancer and melanoma. In the early 1990s, the Foundation took the steps to address the need for an all-encompassing body that would act as a national voice for people facing blood cancer and bring together like-minded groups in other Australian states. The vision of the Leukaemia Foundation of Queensland was to ensure care, support and access, regardless of borders. The establishment of the Leukaemia Foundation of Australia was achieved with the involvement and assistance of government officials, medical professionals, corporate supporters and individuals across Australia. Many people connected to the foundation were actively involved in the process as well, along with the foundation's Chief Executive Officer at the time, Philip Desborough, and Projects Director, Wendy Scaife. By the time the Leukaemia Foundation of Australia was officially launched, the fruits of the unity were being witnessed in the form of greater fundraising opportunities, drive to achieve national projects, and a more economic use of resources. The support and encouragement of the Australian community was outstanding. Western Australians were the first people living as interstate to benefit from the Leukaemia Foundation of Queensland's successful model, with an office in Perth opening in 1993. In 1995, the Leukaemia Foundation of Western Australia was formed. This led to the establishment of the Leukaemia Foundation of New South Wales and South Australia in 1998, then Victoria and Tasmania in 1999. In 1998, the first Shave for a Cure, now known as World's Greatest Shave, took place. This amazing fundraising event is iconic in our history, this year celebrating 23 years. In 2016, the Leukaemia Foundation was presented with an opportunity to unify and become a national entity governed by one board and one executive leadership team. This new national focus presented us with a once-in-a-generation opportunity to reimagine the Leukaemia Foundation's role and offerings for all Australians living with blood cancer. Now the Leukaemia Foundation is proud to stand with Australia to help cure and conquer every blood cancer with care. With your help, we reach 50% of all newly diagnosed people with blood cancer, whether they are in metropolitan, regional, or remote rural areas. We have also invested millions of dollars into vital research that is discovering better treatments and cures for people living with blood cancer. Your support has and is helping shape the future for Australians living with blood cancer. And now, here we are in 2021, having launched the National Action Plan and established the Blood Cancer Task Force. Once again, like in 1975, focusing on 4 major priorities: empower patients and their families, accelerate research, enable access to novel and specialised therapies, achieve best practice. These priorities align so closely to where it all began with the 4 original goals set in 1975: to provide medical care, provide patient support, fund research, and educate patients, their families, and nursing staff. I'd now like to welcome somebody who has been providing that vital care, long-standing Leukaemia Foundation staff member and treasured colleague, Marianne Skaparis. Welcome, Marianne.
Thanks, Emma. Learning new things, as I've often had to embrace over the years. Technology is one of them that takes me a while to accomplish and get on top of really quickly. So welcome here this afternoon. I feel quite privileged to be a part of this seminar. When asked to give a reflection of my time at the Leukaemia Foundation and what it means to me to work for the Leukaemia Foundation. I commenced working with Leukaemia Foundation as a support services coordinator back in January 1995. This, of course, followed 2 years prior to me starting as a team member, a paid staff member. I was volunteering with the foundation. I feel blessed that I was successful with my application back then and have continued to remain committed to making a difference with a team of dedicated and passionate colleagues. The foundation back when I started was like a big family, as you can see from the photos. From staff to the many volunteer members in our branches, we work together During my early years, I developed quite strong friendships with many of our branch members, and I still to this day remain in contact with a few. Back in the 90s, we would communicate mainly via phone and paper trail. Yes, back in the 90s, we would write letters, and the applications for assistance were sent in big envelopes. We were busy bees, but we remained regularly in contact with our healthcare professionals and with our branch members during these times. For those of you who know me well, both staff and members, it's always been about the relationships that we build and the trust that follows in these relationships. I remember when emails were first introduced, and like all things new, we thought at the time, oh my goodness, how is this going to work? What will this mean for those who can't email? There will be a breakdown in communication. But like all things in life, we adapted and focused on finding new ways. We learned new skills, we embraced change, we learnt new techniques, and we celebrated these as we remained active and responsive to the changing times. Staff and branches rallied together to achieve goals, and we never lost sight of our vision to care. We would come together each year back then in October, and we'd celebrate our achievements and successes at the branch conference, and we'd finish off with a big dinner. Lots of laughs were shared, and the camaraderie was felt by all who participated. So over the last 26 years, yes, that long, I have grown both spiritually and unfortunately physically. However, I remain committed to our cause and value every opportunity that I am given to learn and to give. We have come a long way, and I've always felt thankful to belong to an organisation that has over many years maintained its vision and mission to improve the lives of those living with blood cancer. So the question, what does it mean to me to work at the Leukaemia Foundation? Well, it means that I'm given a daily opportunity to reflect and give thanks for things that give meaning in life. I do. In every interaction I have, an opportunity I'm given to engage with another human being, I will always stop, open my eyes and heart to what I can take away and learn from every interaction I have. I appreciate the fragility of life, the strength in resilience, the will to learn and adapt, and the power of love. We all have something to learn from each other and should take a moment to notice what another person can teach. It is the little things that bring us joy in life, and we should never underestimate the feeling of being connected. So that's a little bit about my reflection and what it means to me to be a part of this wonderful organisation. And it gives me great pleasure too to introduce a lady that I have known over many years to join me now. Sandra, would you mind joining me? Hi, Sandra. How are
Hi,
you?
Marianne. Good, thank you.
So just to share with everybody who's listening in today, are you happy to share with us where you're from and touch on who in your family and your story, share your story of how a blood cancer has affected your family?
Yeah, sure. We are, I think, just your typical kind of family of four, two parents, two beautiful daughters. And we live in the beautiful northern rivers or northern New South Wales, just below the border, Queensland border. We were just doing normal family things many years ago, two working parents, when we suddenly had a very sick 4-year-old. So our daughter Talia was diagnosed with ALL at 4, and being a regional New South Wales family, we found ourselves in Brisbane quite quickly. And I think, you know, prior to her diagnosis, we were a reasonably healthy family. I didn't really have an awareness of cancers or even the Leukaemia Foundation. And I think, you know, those very early few days and weeks of diagnosis were, everything was so surreal. You know, you're dealing with very intense emotions, you're very vulnerable and fearful, you're unfamiliar with the medical environment, and also the trauma that comes from very kind of invasive medical procedures. But we were really fortunate that very early on, several weeks into her diagnosis, we were referred to the foundation. And I still remember the day that the blood cancer support coordinator came to visit us on the children's ward. And I remember it was because it was just like a great weight was lifted off our shoulders. I do recall the doctor saying to us that we needed to find accommodation like quite close to the children's hospital. And so for us, that was something, we didn't have family in Brisbane, and that was quite a daunting prospect for us to just come up with accommodation around Hurston in Brisbane. So what happened for us really quickly was the foundation provided us with a 2-bedroom unit just 2 blocks from the Children's Hospital, just down the road from Mincombe Village in Hurston. You know, it was safe, it was stable accommodation, kind of like one of those basic human needs. So I can't, you know, it's hard to describe how important and what a difference it made for us as a family to have that accommodation, because we just didn't know what else to do when our world was very much tipped upside down. And it meant that, you know, my husband and my other daughter could come and stay with us, and it was like a home away from home.
A home away from home, that's exactly how it was described, wasn't it, Sandra? You know, and still is to many families who come into our accommodation.
Yeah.
During that time, what other valuable connections and support did you receive from the Leukaemia Foundation?
So many, on so many different levels. I think without the support of the foundation, I think I can honestly say I'm not sure whether our family would have made it through that period at all. It's really difficult to find words to express the strain that our family was under. And so, you know, any words I do use are probably going to be a little bit understated, but, you know, not only are you dealing with your child's mortality, which is a really weighty notion, but you're also juggling all of those daily events and strains, things like bills, relationships, and employment that just don't stop because your child has cancer. So the foundation helped us financially in regards to expenses like phone bills. I can remember them paying the registration on my vehicle at one point. And when things got really tight, mortgage repayment on our family home back in northern New South Wales. And, you know, it might seem that those kind of financial gifts are really small, but I do remember one of the really poignant things for me was that the foundation paid to have a phone, or the phone connected, and paid our phone bills. And that was something that made a huge difference for us, because with Talia and I living in Brisbane, the fact that she could hear her father's voice and her sister's voice on a daily basis was something that lifted her spirits when there was not really much that I could do, you know, on a day-to-day with her in treatment. So I think too, the other really lovely thing about the Leukaemia Foundation was the staff, and how supportive the blood cancer support workers were. They have an immense ability just to listen to all of those really difficult emotions that you have that are related to grief and anger. And they really get that it's about the journey and not just the progress of treatment at the time. And that you need so much help just to get through those moments. And, you know, I can remember that the ongoing fear that I had when Talia was in treatment was something I never had to explain, because the counsellors just implicitly understood exactly what we were going through. So, yeah.
I do remember you and Talia in that education room, or for want of a better word, that little breakout room, and we had some lovely volunteers who donated videos and books and puzzles, and, you know, and how we spend time with our patient is also something that I think shouldn't be underestimated, because you are in a capital city for such an extended period of time, and when you're emotionally exhausted, you can often be really exhausted. You can be exhausted as well, and to have to then engage with, or how to spend time, quality time with your patient. They, they did provide different things that you could engage in to kind of, have that time pass.
Absolutely. I can still remember one of the most favoured things to do was to put Talia in her pram, wheel her to daily chemo, but then on the way home we would drop in and visit Pauline at Mincombe Village. I'm not sure Pauline celebrated our arrival as much as we did hers, but they had a gorgeous little library there with children's books and the videos, as you say, and we used to just hang out there in the office for quite some time, probably not really wanting to go back home to our unit where it was just me and Talia and the Barbies.
That's right. That's right. During that time, Sandra, back in when Talia was having treatment and you did go home, did you feel always connected with the foundation, and how did you go about reaching out to them back in those days?
Yeah, I did, and still to this day here I am still connecting with the foundation. So it has been a very long-term relationship for us. One of the things that I think prompted or assisted the journey with the writing of my book was I can recall getting very kind of frustrated at the lack of information or support around a particular high dose steroid that Talia was using at the time. And I can remember them reaching back out to the foundation at that time saying, is there something I can read? Is there a way to manage these kind of horrendous side effects? And the foundation were able to put me in contact with a researcher who was doing some psychosocial research with the foundation at the time. And that really started a long-term relationship with the foundation where they were very much in support of the development of my book and have been my biggest supporters in terms of getting that supportive information for parents out to families that are walking that same journey. And what I love about that is families can access that book because the foundation fund the printing of those books and give that book, or lend that book to families. So you really, it's been a very long-term relationship and one that's still ongoing.
I know I've valued my connection with you because, as I said in the introduction of our little segment, it's all about the connections that we make. And I think if we keep our eyes open and hearts open, we can often put people in touch with and connected to the people that can fill their bucket, so to speak. And I know that when we did create that opportunity way back where you could meet that psychosocial health researcher, I know that they too got enormous value out of their interaction with you. So I think it's a two-way street when the interaction is good. Yeah,
Thank you.
absolutely. I'll just ask Emma, is there...
Thanks so much, Marianne. And of course, thank you to Sandra as well for sharing your journeys with us. And thank you again, obviously, to all the supporters that enable this wonderful continued care and support that we can provide. It's now my pleasure to welcome Catherine Treble. Catherine's based in country Victoria, but I've really loved catching up with her, learning more about the families that she directly supports, and now look forward to her sharing her perspective as a blood cancer support coordinator for the foundation. Thanks, Catherine.
Thank you for your time and the opportunity to share with you all today. As Emma said, my name is Kath, and I have the privilege of being a blood cancer support coordinator based in Shepparton. Whilst I have an assigned catchment area, I really am very fortunate to be able to support people living with a blood cancer diagnosis and their families right across Australia. As you've heard from the esteemed speakers before me, the evolution of the Leukaemia Foundation is inspiring and continues to drive us to continually improve our services and reach for people living with a blood cancer. Soon you'll hear from our CEO, Chris, about the future direction of the Leukaemia Foundation. I'd like to share with you the here and now. Working at the coalface of the organisation allows me to see the incredible impact of your support. I'd like to introduce you to Omar and his family to demonstrate the difference your contributions make to the people that we support. Please note, Omar's name has been changed to respect his privacy. 3-year-old Omar's family migrated to Australia 4 years ago and settled in regional Victoria on the border of New South Wales. Together, they began their new life in Australia and started a family. Omar's dad held a managerial position in retail, and Omar's mum was a personal care worker in an aged care facility, so they were well connected to their local community. I received a referral when Omar and his family found themselves at a major treating hospital in Melbourne, alone and frightened, learning their son had a diagnosis of leukemia in the middle of a global pandemic. The family had a mortgage on their home. Their extended family, whom were the bulk of their emotional support, resided in India. Australia's borders had closed due to the COVID-19 pandemic. Both parents had to cease work immediately for the indefinite future to care for their son, who was facing 6 to 12 months of intensive treatment and required them to remain close to the hospital. I reached out to the family to connect, and with my words, I wrapped them in a warm hug, offering immediate emotional support and reassurance that we would do everything we could to support them in their time of need. We secured accommodation for the family at no cost in our Melbourne accommodation facility, the Building of Hope. The aptly named accommodation provided the family with not only physical security, but also the opportunity to be supported by other families living in the accommodation who willingly reached out to offer their support. We liaised with social workers and financial counsellors to assist the family to navigate conversations with their bank to have their mortgage placed on hold. The family were provided financial assistance to enable them to purchase food and cover some immediate bills. We collaborated with local community charities and also provided who also provided further financial assistance. Like many other people living with a blood cancer in 2020, with a sense of isolation both from their community but also their treating centres, Omar's mother turned to our website, seeking trusted sources of information and quickly learning a new language of leukemia. Omar's father joined the Leukaemia Foundation's disease-specific Facebook page, finding a wealth of information and support in a community of people with lived experience of Omar's disease. Omar's parents joined our newly created online support group for parents of a child with blood cancer, which allowed them to feel seen and heard by others walking a similar path. Here they could share their vulnerabilities and fears and seek guidance in a safe and supported space, all of which allowed the family to breathe and adjust to a new reality. It is through your generosity that our hand-holding and support has and will continue to be available for as long as Omar and his family needs. While many of us in the team wondered how we could deliver outcomes for people in our new world order and were concerned our compassion may not translate without face-to-face model of support. This is one example of the ways in which families can access a little or all of our support offerings anywhere along the trajectory of their disease, under any circumstance, and still feel the care and compassion that we strive so hard to achieve. Despite the uncertainty of the COVID-19 pandemic, it has presented real opportunity for us to reflect, to honour the legacy and efforts of the past, and be guided by the goals of those who had historically provided the support, by pivoting our services to ensure we continue to meet the needs of people living with blood cancer. The introduction of online support groups has enabled connection during a time of significant isolation and uncertainty. We have had people living with blood cancer aged 17 to 89 join us online from all states and territories whilst at home, be it in a metropolitan city, a regional area or a rural town, at work, or even from their hospital bed. Some have embraced the opportunity to connect with others on what might have been a good day or indeed a not so good day, knowing that they will be supported by their peers and staff in a safe, supported space. Through consumer feedback, the flexibility of this online support service has proven popular and will remain one of our ongoing services long after COVID-19. One of our current proudest moments is a 2021 online support group targeted to and run only for male attendees, which to date has over 40 RSVPs. This level of engagement has been unheard of in our previous models of care. Our website and disease-specific Facebook groups have seen a spike in engagement as a result of specific content that has been developed in response to consumer need and provided a source of trusted information and education for people living with a blood cancer to empower them in a time of great uncertainty. Our Cancer Concierge project continues to evolve as we test and develop iterations to ensure our reach is broad and understand not just the need, but how and when a person needs it, so we can be as targeted and relevant as possible. As we move forward in a rapidly changing world, we continue to work very closely with people living with blood cancer to understand their needs and aspirations that enable us to implement care and services. I am honoured to be part of the Leukaemia Foundation story, to take forward the legacy of those that made a positive difference to those facing blood cancer, and commit that my practice is underpinned by this passion, to provide our current care and services as a legacy of a future to be proud of. Thanks.
Thank you, Kath. Wow. How lucky are our patients and families? They're certainly blessed to have people like you and Marianne and our incredible team of blood cancer support coordinators and accommodation coordinators across the country standing by their side. I do encourage you all again to ask questions if you feel via the Q&A section located on the panel of the side of your screen. It's now time to hear some special messages from our accommodation villages across the country.
Hurston Village. Just want to send well wishes to every patient and family who's ever stayed here or at the village green over the years, and send an incredible thank you to all the supporters who have made that possible.
Hi, it's Danielle, Office Manager from the Leukaemia Foundation in South Australia. Our village and office opened in December 2013, and since then, with your generous support, we have been able to provide 250 families 25,000 nights of accommodation. Thank you so very much for your generous support. Without you, this wouldn't be possible. Thank you.
Hello, my name is Marie Chaplin and I stand here at ESA Village, Dutton Park. Over the years, I have met and supported many beautiful families touched by blood cancer. It warms my heart to know that I can be a part of an organisation that can make a difference to many patients and families who are touched by blood cancer. It is thanks to you that I can be part of this team. Your dedication, loyalty, commitment to the Leukaemia Foundation is so very much appreciated. And on behalf of the families you have stayed with us, I would like to say thank you.
A big hello from Melbourne. My name is Milena. I'm coming to you from the Victorian Patient Accommodation Centre in North Melbourne, where I work as an access and navigation coordinator. On behalf of the Leukaemia Foundation, I want to take the opportunity to send our well wishes to all who have visited or stayed with us in the past. And to also a huge thank you to the incredible, generous people who support that work will do. Thought your support, you ensure we can therefore patients and families when they need it the most. Thank you again.
We would like to acknowledge the patients and their carers and their families who have stayed with us here in the village, and we'd also like to thank our wonderful supporters for enabling us to do this.
Hello from Karis and the Leukaemia Foundation team at our Sterling Cross Apartments in WA. We wanted to take this opportunity to send our well wishes to all who may have visited or stayed with us. And also a thank you to the amazing people who support the work of the Foundation to ensure we can be there for patients and families when they need us most. We appreciate you.
Hi, this is Sharon from the Glen Jones Sunland Village. I'd like to acknowledge all the patients and carers that have stayed with us since 2007 and the supporters who've made this care possible. Thank you, and I hope you are all doing well.
Wow. How fabulous was that to see the impact of your support from one side of Australia to the other? And I hope you enjoyed seeing some familiar faces there too. You may have read in the news the last few weeks regarding the appointment of our new CEO, Chris Tanti. I'm thrilled to advise that Chris has been able to join us today for this special supporter seminar, and he'd love to share a few words with you all. Welcome, Chris.
Hi, Emma.
Hello, welcome. How are you going? Coming from Sydney today?
It's raining and gloomy, but you know, I think it's like that along the eastern states anyway.
Yes, we've had a bit of that.
So thanks. It's been really interesting listening to the stories from staff, and I logged on late, so I missed all of Trevor's talk, but I'll be meeting with him in the next couple of weeks. So, but it's really interesting to see the history of the organisation and the magnificent contribution that the members and the branches and the community have made to the organisation. You know, one of the reasons I was attracted to the role was because of that, because it has its roots in the community, and when I think about Sandra talking about what her needs were, you know, the organisation being able to meet the basic needs that, you know, she required, which in lots of ways, when you think of a high-tech medicine sort of world, we forget about. And in my early exposure to oncology, I was really clear that in so many ways we actually forgot about those needs, the psychosocial, emotional, sort of practical needs of people, and when we're really focused on disease and illness, but actually there's a whole other dimension to people's lives. And so that's why I was attracted to this, because it's really good, practical, evidence-based support, which I think people are looking for. You know, and I think when you think about those sort of four guiding principles of the Leukaemia Foundation, and you think about the national action plan going forward, like, you know, 40 years ago we had it right, which doesn't mean that there's not a lot to do. There's a heck of a lot to do. And the other attractive thing for me was the 0-35 target, and I think organisations like ours need to have targets. In a lot of the organisations I've run, I've been very clear about, okay, so what is it that we want to achieve? What is it that we have to achieve? And you know, really putting the patient and their families right in the middle of that, and never forgetting that that's why we're here. So for me, there's a heck of a lot of work to do. You know, we don't reach everyone that has a blood cancer, and I really want to step that up. COVID's presented a whole lot of challenges, presented a challenge for me in respect to running an organisation when there are no staff around. They're all busily working at home. But it's presented some opportunities as well in terms of our reach into some of the more remote communities and regional areas of this country. I've done a lot of work in regional and remote Australia, and I know how underserviced they are by health services. So I'm really keen to move that along. Really, that's all I wanted to say. I'm in awe of the people who started the organisation. I'm in awe of the members. I met a few of them a couple of weeks ago in Redcliffe, and it was the most humbling experience for me, meeting people in the community who actually wanted to make a difference. That's why I started social work. I'm luckily, you know, paid to do what I do, but there are a whole lot of people in the community that have made this possible and have made it possible for us to work with thousands and thousands of families over the years, and we owe them a huge debt of gratitude.
Yeah, they're certainly superheroes in our eyes, that's for sure. But we're really obviously excited to have you on board as well, Chris, and thank you for taking the time to say a few words today, but also wanted to thank you for your dedication, for stepping up to the plate and registering for Shave. I thought I'd throw that one out there, that in case any of our attendees didn't know, Chris is braving the Shave on the 21st of March, is that right?
Yes, the further away we can get it, the better.
Oh no, it's a wonderful thing, and I think it's fantastic that you're showing your support by participating as well. So but once again, thank you so much for joining us, and I'm sure you're looking forward to connecting with many supporters and members down the track as well.
I really am.
Yeah.
I really am. Absolutely. Thank you, Emma.
Thanks, Chris. So now we'd like to open up for some questions. We do have a couple that have come through, so I'll just direct those. We have a question for Sandra and Marianne from Danielle, wondering how long have you known each other? Or you've known each other for a long time, and how has your connection changed over the years?
Oh, we have known one another since 2006, so it is a long time.
And we haven't changed a bit.
We still look like spring chickens. I'm not sure how Marianne might answer this. I'm not sure that I would say. I think our probably our relationship started off very professional in terms of blood cancer counsellor and patient, or mother of patient, but probably over the years has become more collaborative around some of the work of the foundation, and you know, just some of the work, Marianne, that we've done in terms of arranging some of the forums that I've spoken at and supported people to understand a family's journey. So it's probably turned into probably more of a colleague work collaboration relationship than what it started.
It's funny when you ask to, and thank you for that question, because I think it is actually a really good one, because everyone does have a lens that they can place on what they take away in an interaction. And I look at Sandra, and I remember the time when I first met her back at Hurston, and she possibly may not remember me, because I know there was a few blood cancer support coordinators who were very valuable to Sandra and Talia at that time. Certainly with the interaction moving forward with Pam, and how the impact of that interaction and the, you know, what the value that was held in that space and the conversations that were shared, I think a relationship does morph into a collegial or one of admiration for just for human nature. I look at Sandra, and she's always been someone who's extended herself in the sense that when she did write the book, and she was offering it as something for others who had experienced that journey as a comfort, she would always be so generous in saying that she would be happy to share her email to have further connections with those parents who were, you know, who were traveling a similar path. Certainly with recent times, collegial again, just asking Sandra to share with everybody in her unique way her story, because I do think a story shared really does place an enormous impact, and we don't know who at any point in time where we make an impact, but you know, we do identify some people who are willing and who are happy to share that they can actually make a significant difference to those who may be looking, whether it be in written form or whether it be in the presentation form. So thank you, Sandra, for everything that you have shared with us.
Yeah, thanks again. And of course, Sandra, thank you for the incredible advocacy that you do for all patients and families, blood cancer patients and families as well. Another little question maybe to Chris, if you're available, Chris. This is from Wendy. Lovely to have you on today, Wendy, as well. Where will LF be in 5 years' time?
That's a really, really good question. I think it will continue to be where it is, in the sense that it will continue to lead the blood cancer community. I think it is already a leader in this space, and one of the things that we need to make sure that we do is we need to keep setting the standard. So really, it's about continuing the work, the great practical work that we do with patients and their families, meeting people's basic needs, meeting all of those requirements, extending that out from the 30% that we currently service to, I'd like it to be 90%, I'd like it to be 100%. So really capturing all people who are going through these problems, making sure that we have good coverage. There's a disparity between metropolitan and regional areas, 13% disparity. I want that gone I don't want that gone in 5 years. I want that gone in 2 years. And I want us to actually be leading global efforts in this space, really having an impact globally, as well as locally, because there are so many people who could learn from the work that we've done here. And I want to make sure that we get government money. I want to make sure that we get government funding. There's a whole lot of money that goes into, in mental health, we used to say, oh, well, the argument with the Prime Minister was, well, you've done cancer now, you've got to put money into mental health. But actually what we did was, what the government did was acute care, acute cancer, and not a lot of work is done in the community. And a lot of the work that's done in the community is done by people raising funds to do that work. So I think government needs to step up. Yep. And so I guess that's where I'd see us in 5 years' time.
Excellent. Well, we're all very excited to face those next 5 years and onwards. Looking at the last 45, it's been pretty amazing. So
it has been.
Looking forward to the next. Look, we are running out of time, everyone, but thank you all again so much for your questions and comments. Any that we may not have been able to cover, we will endeavour to get back to you via email or give you a call. But thank you so much for your attendance and for reminiscing and celebrating this monumental journey with us as we work towards 0 lives lost to blood cancer. Over the coming days, you'll receive an email with a link to view this session. But a big thank you once again to our speakers, the special video by Dr. Trevor Olson, Marianne, Sandra, Catherine and Chris. And thanks to you, each one of you are beating blood cancer, be it by providing future hope through leaving a gift in your will, your support through your donations, by volunteering your precious time, or through your advocacy and membership, through your care and dedication as a current or a past staff member. The Leukaemia Foundation is here today because of you. Patients and families are getting the care and support because of you. More patients are surviving because of you. On completion of today's event, a short survey will pop up. We'd really appreciate your feedback, so I'd ask that you do complete it. And you can let us know what you want to know more about and how we can make these sessions better for you. Please mark your diaries also for some upcoming events. Our next supporter seminar is on how the pharmaceutical benefit scheme process works and new drug listings. And that's planned for early April. Of course, World's Greatest Shave is from the 10th to the 14th of March. Sign up or sponsor a shaver. or read and share our inspiring shave stories on our pages. And another supporter seminar is in late May, focusing on research and developments into childhood cancers. Well, that brings us to the end of today's session. Thank you again so much for joining us, and take care.